Thank you. After Dr. Yanandra's lecture and talk on different types of PDE inhibitors, I think the talk given to me is whether to go for on-demand or regular dosage of PDE5 inhibitors. Up to a decade back, we were only planning giving for on-demand in majority of the cases. But now these days, there are a lot of studies which are showing that some patients do get benefit with regular dose of PDE5 inhibitors at lower doses. There are various studies, and studies reports are also controversial. In the sense, there are few studies which claim that daily dosage is a better one, and few studies claim that on-demand dosage is better thing, and few studies claim that there is no much difference between both of these two. However, the consensus we can see after going through the studies, and this is a study done on vardenafil, which did not produce greater sustained effects than on-demand vardenafil in men with mild to moderate ED, suggesting that daily dosing of PDE5 inhibitors does not produce sustained clinical benefits beyond cessation of treatment above those observed with the on-demand administration. This is from the Restore study, which is a popular one and which is quoted off in a lot of studies. But in this study, vardenafil has not been found much beneficial as day-to-day dosage. Both were same. And regarding dose on demand of vardenafil improving erectile function recovery after radical prostatectomy. In fact, these are the people above 65 years, people suffering with LUTs, that is lower urinary tract infections, above 65-year-old suffering with prostate cancer, prostate hypertrophy. These are the people who would probably benefit with the lower daily dosage. Anyway, this after radical prostatectomy, the randomized placebo-controlled trial reported by Montour C and colleagues attempted to determine if nightly vardenafil was more effective than on-demand drug in restoring erectile function after radical prostatectomy. The study, men with ED following bilateral NSRP stands for nerve sparing radical prostatectomy. Vardenafil was efficacious when used on demand, supporting a paradigm shift towards on-demand dosing with PDE5 inhibitors in this patient group. This is somewhat paradox comparatively with a lot of recent studies which have shown or which have come out with the findings that daily dosage is more superior. But in this study, they have come out, especially following bilateral nerve-sparing radical prostatectomy, the group has said benefited with demand dosing rather than daily dosing, which is in minority. Here is mounting evidence that daily dosing is preferential in several groups of patients. The groups that will most likely benefit from daily dosing range from post-prostatectomy patients to those with concomitant lower urinary symptoms. And the biological evidence for continuous treatment for erectile dysfunction is significant, but the mechanism for why PDE5 inhibitors improve lower urinary tract symptoms is unknown. As I mentioned, especially above 65, comorbid prostate cancer or prostate hypertrophy, people who have been operated for prostate, these were the people who got benefited with the low dosage of the PDE5 inhibitors, and also the urinary symptoms were also improved, but why they have improved is not very clear. Low dose versus on-demand high dose of vardenafil in diabetic patients with erectile and ejaculatory dysfunction. Daily use of 5 milligrams of vardenafil significantly improved the quality of ejaculation and lower urinary tract symptoms more than the on-demand use of 20 milligrams of vardenafil. It may be beneficial to give 5 milligrams vardenafil daily to patients over 65 years old who do not benefit from the treatment with 20 milligrams of vardenafil, or patients who have lower urinary tract symptoms over 65 years. So again, I stress, a lot of studies are in favor of tadalafil or other PDE5 inhibitors in a very low dose daily rather than on demand, because it also improves the LUTs as well as the premature ejaculatory function of the person. So the efficacy rates of tadalafil once a day and on demand were similar. This is again a study which is contradicting with the other studies which are in favor of daily dosing. The study done by Peng Yang and Dong Wei Liu have said that once a day and on demand were similar, and though they didn't find any significant difference in safety, it was only found between the two dose regimens of tadalafil. So they are not favoring any particular dose regimen. They say both are safe. So according to this slide, if you take McMahon study on the top, here it has been clearly come out with a report saying that this is definitely daily dosing is more superior. Daily dosing of mini dose 5 milligrams of tadalafil is more superior to 20 milligrams of tadalafil on demand dose. They have also done a crossover study, and they have also done they have given tadalafil at 10 milligrams, which is effective for previous on-demand tadalafil non-responders. So those people who didn't respond on demand tadalafil, they responded with daily dose of tadalafil. That was a significant finding by McMahon. Of course, other studies like Post and Rajafer and Kang et al., Jabo et al., all these studies, they have mainly compared the tadalafil with placebo. They have compared the PDE5 inhibitor with placebo and said that they are definitely more superior. So in this slide, it was McMahon study, which was more important in favoring of daily dosage of lower dose of PDE5 inhibitors, especially tadalafil. In the study population, both tadalafil formulations generated significantly high response according to the outcome measures and were well tolerated. The once a day 5 milligrams dosing showed higher compliance and marginally reduced side effects, thus making it an attractive alternative to on-demand therapy for erectile dysfunction in post-radiotherapy patients. So as I mentioned again, comorbid disorders, 65-year-old above, all these people with prostatectomy, operated, urinary tract infections and urinary problems which have been operated, and then even post-radiotherapy, these people have benefited with the daily dose rather than on-demand dosing. So what are the advantages and disadvantages once we compare whatever I have mentioned in these studies? On demand, there is a still stigma of patients able to perform better only with the drug. So whenever they want to have sex, they have to take a drug, and that makes gives an idea to the patient. He is weak in the sex and he needs a drug, and that stigma is attached with on-demand drug. Well, poor compliance also will be there because he might forget, and once he goes out, he might have a sexual stimulation and might want to have sex, but he doesn't carry the drug. Especially psychogenic erectile dysfunction. Even in my practice, whenever a patient comes with clear-cut, no secondary causes and clear-cut psychogenic erectile dysfunction, I give a trial of PDE5 inhibitors on demand for 1 or 2 things, and then his erection improves, and that gives him a positive feedback that everything is fine. And so in psychogenic erectile dysfunction, initially for few attempts, I tried the PDE5 inhibitors. And daily dosing is very useful in elderly post-surgical patients, and also it has less side effects. The less side effects is because we give lower doses of the drug daily, while on demand we have to go for higher dose. So the less side effects is also an attractive one with daily dosing. And easy waning off from PDE5 inhibitors may be enough to restore sexual function in cases especially psychogenic on demand. Then it is cumbersome to carry drug all the time, and that is why probably majority of the patients doesn't prefer on demand, and they prefer daily dosage of lesser dose. So these are the advantages and disadvantages of daily dosing of PDE5 inhibitors. So how to choose this, whether you choose daily dose or whether you choose on demand, it is based on the frequency of intercourse of the individual would like to have, the way he is having, and concomitant medications which he is using, drug interactions and metabolism affecting the drugs, and especially side effects where we prefer lower dose. Age, again, as I mentioned, again I am stressing, above 65 years, people with lower urinary tract symptoms, people with prostate hypertrophy, people who have underwent radical prostatectomy, people who went radiotherapy for the cancer prostate. These are the people who would benefit with daily dosing. And of course, patient's expectations, convenience also have to be looked, and whether he has any addictive qualities premorbidly has to be looked after, because there might be abuse of these drugs by these people. And I thank for giving the organizers for giving me this opportunity, and thanks a lot, sir.